Good morning, everyone. We are just going to give it a couple more minutes before we get started, so just hang tight, and we'll get started in a few minutes. See, we have a lot of people joining us, so I was just saying that we'll give it a couple more minutes before we get started, and thank you for joining us. All right, everyone. Well, once again, good morning. Thank you so much for joining us today. My name is Alison Shoenberger. I am the Field Development Manager and the local staff contact for Autism Speaks here in Colorado. I am going to kick off our presentation today, and I'd like to start off by sharing our mission statement. For those of you who are new to our organization or might want just a little bit of a refresher. Autism Speaks is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of people with autism and their families. We do this through advocacy and support and by focusing on 5 key mission objectives. Those objectives, I'm just going to read them. Increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs in the areas of cause and better interventions for autism and related conditions, increasing early childhood screening and timely interventions, improving the transition to adulthood, and ensuring access to reliable information and services throughout the lifespan. Before I turn it over, I wanted to just share a few things in regards to kind of how to engage with Autism Speaks here locally. I'd first off like to invite all of you to join our Facebook group. This group is where we will share information, resources, local happenings and events, and where we really encourage the community to share ideas and to support each other. Another great way is our Autism Speaks Walk. The walk is the world's largest fundraising event supporting the autism community, and we host over 70 walks across the country. And here in Colorado, we are set to host our event on September 12th at Infinity Park. And this is really just another great opportunity for the community to come together, support each other, and learn about resources in the community, all while helping Autism Speaks do the important work that we do. So if you're interested in joining the walk and helping us to fundraise, I'd encourage you to visit autismspeakswalk.org, where you can register a team or walk in as an individual. And I'm happy to answer any questions throughout this presentation about the walk or about what we're doing here in Colorado in regards to fundraising and events. So that is it for me. It's my pleasure to now introduce you to Kellie Heydrich, the Senior Director of State Government Affairs and Grassroots Advocacy.
Thank you, Alison. And we appreciate everything you do in Colorado. And folks, we will be sending out the slides as well as the recording of this call afterwards. And so those links will be in there that you are welcome to use for any of the information that's presented. We're mostly going to be talking today about our advocacy work around the COVID period and some updates, some governmental updates of things that are of support to the autism community. And I'm really pleased to say that we have a special guest joining us to help in this for the state portion, and that's Josh Winkler, who is the Colorado Lieutenant Governor Diane Primavera's Disability Funding Committee Coordinator and Policy Advisor. He's got a mouthful of his title, and that's a new role for him, but he has been working with the community for many years, and we're excited to have him give some updates. Before I turn to Josh, I just want to acknowledge, you know, we've been doing these webinars in states around the country. We've been talking to advocates and family members, and really having those conversations shape our advocacy and give us stories to be able to relate to lawmakers, governors, and others as we try to advocate for things that are going to be helpful during this period and that are already being helpful. So I want to acknowledge some of the things that we know many of you are experiencing, whether you're an individual with autism, whether you have a family member with autism, you're a provider of autism services. We know that for school-aged individuals, that abrupt discontinuation of educational services, it was hard for everyone, but it's especially hard for individuals with autism who, for whom routine is very critical, and some of whom don't do well with telehealth and remote learning. Closure of day programmings also for adults with autism. Clinics and the shift to telehealth. There have been some things that have worked well, and that's an important offering to do things by telehealth instead of having nothing, but it certainly doesn't work for everyone, all individuals with autism. We know mental health challenges for individuals as well as for caregivers when we're all packed at home for extended periods and people don't have their normal life. It's really affecting people's mental health, and that's okay, and we should all be willing to talk about it and what our needs are. Lack of connection to community opportunities and supports. Disruption of employment. Many people with autism who are able to work and worked very hard to engage in those employment opportunities. Some of those have just like a broader set of jobs has fallen for now, and that's disappointing and can have a significant effect on those individuals. Respite relief. Some families are not getting respite relief, and it's something that everybody needs, and we want to avoid tragic circumstances where there was a story we heard about a mom of an individual with autism who just needed to hop in the shower and thought everything was safe and had a child go wandering. That was a tragic circumstance happen. So we know how important it is, and hope to support families with continued respite. Loss of income for some families, challenging behaviors that have escalated in many cases because of the circumstances, things that may always be challenging but have been heightened, and some individuals with self-injurious or aggressive behaviors. And then access to health care with appropriate supports is always important, and especially important now, and can be challenging. So our state level advocacy, and we're going to do state first, and then we're going to hear a little bit about some of the federal things that we've been working on and results that have been obtained or that we're continuing to work on. In the area of state advocacy, we've primarily been focusing on healthcare related flexibilities and supports, home and community-based services, and special education and early intervention. I will, after Josh speaks, and he's going to specifically address some of the areas that I've mentioned of concern, and then I will cover some additional information for you, and then we'll do some questions, and then we'll turn to federal. So at this point, let me turn it to Josh to walk through some information, and there are some links in here for you when we share these slides that you're welcome to use if you are a policy wonk kind of person or just want to see more detail. They'll be there for you. So Josh, thank you very much. I'll turn it to you.
All right, thanks, Kelly. So as Kelly said, I'm kind of new on the job. Today's my 9th day in the Lieutenant Governor's office, and the Lieutenant Governor's office really from my house, so operating remotely 9 days into the job. So I'll do my best, and I definitely want to share my information. If there's additional questions afterwards, or you think of something, definitely reach out. So my role is dual. One is to actually staff a committee that's being moved from the Department of Personnel over to the Lieutenant Governor's office. But then the other half is to advise on policy, and to really not just the disability specific policies, but also kind of embed with the governor's policy team and look at where other, more general policies actually do have an impact on people with disabilities. And I'll just give an example. There's been a lot of discussion lately around law enforcement. and on the racial disparities in law enforcement. And I've really highlighted, you layer in racial and disability disparities in law enforcement reaction, the numbers only get worse. So hopefully we'll be able to be that voice. And I do apologize, I have to jump off at 10:30, so I can't stay with you guys the entire time. On the educational side, I think, I think we are really aware of what happened, with the abrupt change, and parents had to figure out how to become teachers overnight and do it from home, and then you add kids with special needs on top. That makes it way more difficult. One of the things that I've learned quickly is in Colorado, the Department of Education doesn't actually report to the governor's office. They report to the state education board. So there's an added layer of complexity there of it being an executive branch agency, but really reporting to that the state education board. That said, well, and local control, for those that maybe are new to Colorado loves local control, especially in education, where the local school districts have a lot of say in how their programs work. That doesn't mean that they can bypass state or federal law, though. So IDEA still applies, 504 still applies, IEP plans still are in effect. And we've been talking now for about a month with Department of Education. I say we, advocates, people in the governor's office with Department of Education about moving forward through summer programs and into next year for the kids that really, as part of their IEP, they need that hands-on learning. How do we do that if we're still in a socially distanced world? I would love to say there's a golden solution. There hasn't been yet, but the conversations are happening, and I know they're working on the legal guidance around that. And I'll actually say Disability Law Colorado has actually been leading a lot of that effort, just because they understand the legal aspects of IDEA and 504 and how those apply. So hopefully in the relatively near future, there's some kind of real guidance comes out on that. Right now, there's honestly nothing there to share. I haven't even seen a draft of the guidance at this point. The day programming is just recently starting to reopen as the states reopen, but at a very limited capacity. And I apologize for government links. That link is ridiculously long, I just realized. So yes, they're reopening, but they're reopening very slowly and at limited capacity. And some, because they're private entities that are choosing whether or not to reopen, have not reopened yet, because my belief is it's a financial decision. I don't know their finances, but my belief is, there's a certain number of people they have to be able to serve in order to actually make that financially possible for them to do that. And so in a socially distanced world at limited capacity, I don't know that some of them can get to that level yet. So they've chosen not to reopen. Hopefully, as things continue to be opened up, as the rules change, and as more data comes out on how things can be safely reopened, more of those open. The one thing that I think was interesting in this time is they were entities like day programs were able to access, sorry, I'm spacing the word of what is called retention payments. So Medicaid would pay them a small amount. It wasn't what they would normally make, to keep them as providers. And because one of the concerns was, do some companies just quit the business? And so there was a longer term thought there of, hey, spend a little bit of money to preserve those businesses. So the good news is, as things free up, they should still be able to reopen. Most of them will stay in business. The bad news is they are private entities, and so they're not, even the nonprofits, they still could choose to not go back into that line of work. The hope is they will, that they'll continue to do that. On the telehealth side, good news, bad news. Good news is telehealth is here to stay, and there's probably going to be more of it. The bad news is, for people that don't do well with telehealth, some clinics are going to probably choose to do most of their work by telehealth for the foreseeable future, and some may never go back to their regular clinics. Again, a lot of this is the business of healthcare, and if you can see twice as many clients using telehealth, not have as big of an office, there might be a point that some people decide to just stick with telehealth. There was a bill passed in the last few weeks of this weird legislative session in Colorado, Senate Bill 212, that expanded some of the temporary authorities that the governor and Healthcare Policy and Financing Division of Insurance had used to expand the access to telehealth. It expanded some of those temporary provisions into permanent statute, which also, I just want to note, a lot of what was done in the response to COVID were executive orders, were temporary rules. All of that either has to be made permanent through a more formal process that takes more time, or it's going to have to be undone at some point. And that's at both the state and federal level. So over the coming months to years, there will be either a slow unwind of some of those policies, like the retention payments. 2 years from now, they're not going to still pay people to say they'll go back into business sometime. That's going to have to end at some point. And so I think it's really important for the community at large to kind of watch and say, hey, this temporary provision, that really worked. That made life better. That changed this, aspect of my life. How do we make that permanent? Or this really didn't work. Please don't make that permanent. That was really bad. And so I think, staying vigilant over the next, I wish I could give you a time frame, I think months to year probably, as things get unwound, and making sure to just be aware of what's changing, because some of this will go back to normal, and some of that's good and some of that's bad. Where normal was great, that's good, but where normal wasn't great, that's not quite as good. You want to jump to the next slide? Thanks. So mental health, I think everybody on this call is well aware of the challenges in the behavioral and mental health space. The Lieutenant Governor is actively engaged with the Behavioral Health Task Force, which has been meeting, I think, a little over a year at this point. It has grown in its scope because I think as you start to peel the layers of the onion, you find out more and more issues within the system. So on the COVID side, they formed a temporary subcommittee to really focus on the acute needs around the stress and anxiety and all the things about being at home and not being able to leave. But then adding on the layers of disability and respite and all that on top. And then on the longer term, there's work that's gone on here and elsewhere over the years. Some of you may be familiar with, spacing the name all of a sudden, it's through JFK Partners, Can Do, which came from the Autism Commission. They're funded through the Developmental Disabilities Council, I believe, fully now. Some of it might come through JFK. They did some work a few years ago about dual diagnoses and the real challenges that when you have basically any IDD diagnosis and a mental health diagnosis, that instead of that meaning you get twice as much assistance, it means that people point fingers and say, oh, no, this isn't the autism. This is the bipolar disorder. This isn't the Down syndrome. This is the schizophrenia. And so then nobody wants to serve you. And so there was a report came out, now that I'm in government, it's hard for me to say, government, but, a report came out, and small pieces of that have been picked up, but there's still a massive gap in the system. I don't think anybody will deny there's a massive gap in the system for the people that are dual diagnosed, on where is the right help, like who should be providing those services. And I don't know that there's a solution on the table right now, but I know that the Behavioral Health Task Force is trying to tackle some of that. I know the lieutenant governor is, trying to figure out additional ways that can be done within and without the behavioral health task force. But it's a recognized problem. It's just figuring out what that real solution is. The lack of connection and community supports. Okay, so that one, and my apologies, I'm not as familiar with the SLS waivers as I am some of the other Medicaid waivers. But there's normally prohibitions about legally responsible adults, which are often the parent, being able to provide services to the person that they're the legally responsible person for. Temporarily, that has been waived, and that was done so people didn't. So, say you're a parent, your 25-year-old son or daughter is getting services, including the Community Connector service. You don't want somebody else having to come into your home to provide that service. You could provide that service instead. Just in the COVID, social distancing aspect, less people coming into a home is better for the odds of ending up being COVID-19. So that was one of those temporary things that was put into place. And then there's actually several memos about this from Healthcare Policy and Financing. I listed the most recent that kind of laid out some of the details because the earlier ones weren't real clear. And there was a general sense that this service has never been allowed to be provided by a legally responsible person. So people were really struggling to figure out, even providers, whether or not they could bill for that and how that would look. So it's not, again, not an ideal solution. That obviously doesn't help on the respite side, because normally when somebody's getting that Community Connector service, that was, not formal respite, but that was a break for that legally responsible person. So that adds to the stress, but it also decreases the need to bring an additional person into the home. Yeah, thanks. The community employment. So this, I kind of tackled the answer to this one on the Department of Labor side. There was a lot of confusion, and there remains a lot of confusion around who falls in the high risk categories. There's some clear-cut, obvious people who are succumbing to COVID-19 at a much higher rate. But then there's a lot of other people that, and I'll include myself in this, I'm a quadriplegic. I have limited lung capacity. Technically, that's not on the list of things that are high risk. However, if I even get regular pneumonia, that is extremely dangerous, and I'll likely end up in ICU on a ventilator. So figuring out who's high risk. So CDLE has put out some guidance around when they started bringing more people back to work and opening up who could work, around the employer, if you want to go to work, they cannot say, no, you're high risk, you're not allowed to come back to work. And on the flip side, if you are high risk, they can't fire you because you say, I can't come back to work, I'm at too high of a risk. So it's trying to do almost two opposite things at the same time, but really capturing what the individual people need. There are a lot of providers that provide employment services that still aren't because of the risks of being out in the community and being too close to people. That is just an inherent issue we're having, around a lot of services with COVID-19 because of the risk of, close proximity to each other. A lot of providers are just choosing not to provide services for their own safety, for the safety of their clients. It's not, it's not helping them financially to not provide the services. It's just a safety thing right now. The respite, this is technically respite services were never stopped. There was never a change from Colorado's Medicaid on the funding of respite services, on the allowance for respite services, but it keeps coming up. So providers must have chosen not to provide the respite services, at least in the early days or months of COVID-19. I actually confirmed last night because I was like, this just came up again. I feel like just 2 or 3 weeks ago, I talked to HCPF. So for non-Colorado speak. HCPF is Healthcare Policy and Financing, which is the state's Medicaid agency. I don't know who named it HCPF years ago, but that's how people pronounce the acronym. I reached out and I was like, hey, like, again, I want to be clear, respite services never were impacted. And the answer I got back was yes, they were not changed. So if you're having problems there, I would say reach out to your case managers and see if there's potentially another provider that will provide those services, because there is no prohibition on respite services. There's no additional limitations on access to respite services that weren't there pre-COVID. I will openly acknowledge there were access issues before COVID, so those remain. However, the state has not done any changes that should make that worse under COVID. I just want to note a couple other things that has kind of gone on behind the scenes a little bit throughout this process of the COVID response. The crisis standards of care, which is basically who gets a ventilator in a time of limited access to ventilators. Knock on wood, Colorado never got there. There was never a need to implement the crisis standards of care. However, philosophically, having them there and making sure the disability voice was part of that was really important. And a few of us worked really closely with the Department of Public Health and Environment to make sure that disability alone could not be a reason to not give somebody a ventilator. I'm sure you all saw the stories from other states. Alabama was probably the most obvious, and a court ruled that theirs were not legal because they flat out refused people with IDD from receiving a ventilator by their rule. So I will say we talked to people at the federal level about this and had some disagreement from some national folks about some language that we agreed to. Your likelihood, your survival rate in a 5-year, I believe it's a 5-year window, it might be 10-year. It's not your acute survival rate, it's your 5 to 10-year scope, is a factor in the Colorado crisis standards of care. So that does mean that if you have a progressive disability, that could be used against you. But just the fact that you have a disability was not a factor. The governor has had the ASL interpreter and I know this is not necessarily as important for the autism community, but the ASL interpreter at all the press conferences was something, again, other states had to be sued to include. I actually didn't realize till just the other day she's deaf. The sign language interpreter you see on TV usually is actually a deaf woman herself, and there's somebody that sits in the audience and signs to her what the governor says, then she repeats that. So that's cool. And then as well as all the documents being screen reader compliant. And I'll say there was an issue to begin with when the executive orders started coming out, oftentimes 9, 10 o'clock at night. They were simply scans of the documents, and blind people couldn't read them using screen readers. So worked with the communications team, got that remedied. And then one of the things that's being worked on right now that, again, has become an issue in other states, I believe it was Connecticut that there was recently a lawsuit, was the no visitor policies at health facilities, hospitals and clinics and dental offices. And hospitals were doing what they thought they had to do under their public health orders. They were not allowing any visitation. Support persons for people with disabilities, whether that's an interpreter, if that's somebody that gives you physical care, that is allowed under the ADA, and the public health order doesn't bypass that. The Colorado Hospital Association put out guidance to their members about that, and hopefully, given the lawsuit, and like I said, I think it was Connecticut, and the notice from the Colorado Hospital Association, hopefully that problem's a little bit resolved at hospitals, or mostly resolved at hospitals. There's still a need to do something though beyond that, and so we're trying to figure out what to do about all the small, sole proprietor dental offices in rural parts of the state, and making sure that they understand what their obligations are under state and federal law, and that the no visitor policy does not mean no assistance. And the example I've used is, it's like saying that using visitor, like visitor and support person are like pet and service dog. There's lots of places that don't allow a pet, but they're not allowed to not allow a service dog. And so it's the same type of thing, that there is a difference in who that person is that would be coming with them. So that's still in the works. I don't know whether that'll just be like some additional guidance. Like, again, the Hospital Association is the one who put out the guidance to hospitals. That didn't come from the state. And sometimes that's received better, to be honest, than the mandate from the government saying, this is what you have to do. It's their own trade association saying, look, here's what you need to do. Here's how you need to do it. So that's still in the works. And I think that might have been the last of my items.
Yes, thank you so much, Josh. I have a few other state items to cover, but that's the last of yours. And we so appreciate you joining and sharing this information and what you're working on through the Lieutenant Governor's office. And I know you have another meeting, so if we have questions for you, I will follow up with you by email and get back to folks.
Thanks, Kelly. Everybody enjoy your weekend.
Thank you, Josh. I will quickly run through just a couple of other things for folks on the state level, and then we'll pause for any questions that may have come into the chat or the Q&A. So this gives you a little more detail on specifically on telehealth coverage during this period. The governor's executive order, this does apply to public and private. If we advocate that telehealth will remain an option, but some people do better with telehealth than others. We don't want it to become a forced option. So we'll continue to work on that on behalf of the community to have those choices. There are a couple of waivers that most states applied for and received from CMS, which is the federal agency that deals with Medicare and Medicaid. And these waivers gave some flexibility during the COVID period for a number of things that can be helpful to you if you have a family member who receives Medicaid and has autism-related services through Medicaid. So I will not go over this in detail in the interest of time, but it's here in the slides that we'll send out to you in case you're interested in seeing these details. There's another waiver called Appendix K that is designed for emergencies, whether they be nationwide emergencies or more localized kind of natural disaster emergencies, that also provides some flexibilities. And so for services that may need to be modified during this period, there were requests made by our state and that were approved by the federal government to make these allowances. In the area of special education, there were dollars passed in a federal bill that you'll hear a little bit more about from Dave next. And these are the amounts that Colorado will be receiving. These are estimates of the amounts. And there are a couple of different buckets. The K through 12 money will largely go into the, school district formula, but then there's a discretionary fund that's called GEAR for short, that we have been advocating around the nation for some of those dollars to help with special education, things like, and this one is broader, but inclusive of our community, hardware, software, assistive and connective technology, so that when remote learning is possible for students with autism, but they may not have equipment or good, reliable Wi-Fi, that assistance is provided. Helping with appropriate transition, we're really worried about the little ones who should be getting all the early intervention to prepare for joining the special education system in the schools, and the criticalness of that time period to receive all the services that they need to prepare for that. Same on the other end, those that are ending and will be transitioning into adulthood and whatever comes next for them, whether it be employment, higher ed, day programs. And so we're advocating around extensions extra funding, whatever may be needed to help on both ends of those. And then also just to get back to in-person services through whatever means are possible and safe, including during the summer for students that might not normally have summer school, just to address the regression that we know has happened during this missed months. And so pushing hard on, and this is a state by state and even sometimes school district by school district, what is possible, how quickly can we safely get back, especially for those kids that cannot do well with a remote environment. There's a link here to the special education page that has a lot of good FAQs and answers that I just reference here for those of you who may find this helpful. And then one that's specifically on early intervention and some activities that they're working on through the Office of Early Childhood and Early Intervention Colorado. So I'll pause here. My colleague Judith is manning the Q&A and the chat box, and so I'll ask Judith if we have any questions we need to take a pause to address at this point.
I think we've got them all answered as we've gone along, Kelly, so feel free to just keep going.
Terrific. Thank you, Judith. So I'm going to turn it now to my colleague Dave, who is my counterpart on the federal level, and he's going to tell you a little bit about some of the activities that have been happening in Congress and things that we have been working on. So thank you, Dave.
Thanks, Kelly. Great to be with you all today. As Kelly mentioned, my name is Dave Sikowski, and I work on our federal team out of Washington, D.C. So I wanted to just quickly go through where things have gone from the start of the COVID-19 pandemic in terms of congressional action to now, and focus on some of the priorities we've been advocating on behalf of the autism community. So, beginning in early March, Congress started working on a number of different items related to the response to COVID-19. You'll see them labeled here as COVID-1, COVID-2, COVID-3. That just represents the chronological order in which these bills were passed. And sometimes you'll see this is the way that it's referred to in articles about Congress working on different bills related to COVID-19. So I just wanted to put a point of clarity there in terms of why it's referenced that way. So March 6th represented the first bill that was passed in Congress related to COVID-19 response. This really was just kind of the initial tranche of money to assist in the public health response. It was $8.3 billion. On March 18th, the COVID-2 bill passed. This was the Families First Coronavirus Response Act. This was really the first attempt by Congress to start addressing some of the individual and family related issues, as well as some additional healthcare issues during the crisis. So, for example, this provided emergency paid sick and family leave for certain individuals at employers that had less than, or that have less than 500 employees. And we have more information from the Department of Labor that we can share in terms of some of the specifics related to eligibility if you're interested. There were tax credits provided, free COVID-19 testing were available, of course, that's been an ongoing challenge, an expansion of food assistance, and a 6.2% increase in Medicaid matching dollars to assist with the public health and ensuring people can access healthcare services. On March 27th, COVID-3, the Coronavirus Aid, Relief, and Economic Security Act, also known as the CARES Act, passed and became law. And that's something that I'm sure you all have heard about in one way or another. This was the massive relief package that was passed by Congress, $2 trillion, to address a whole host of the issues that are being faced by individuals and businesses throughout the country and economy. So the first thing I have listed here is the economic impact payments. These are also known as stimulus checks. This is the $1,200 payment that went out to every individual, or most individuals throughout the country, as well as $500 for dependents under age 17. This law included the increase in unemployment benefits, $600 per week, on top of existing unemployment benefits, hundreds of billions of dollars to healthcare providers and state and local governments, specifically to address COVID-19 related issues. The Paycheck Protection Program, which is a forgivable loan program for small businesses, was established in this law to try to ensure that employers could retain employees and keep their business operating during this crisis. As Kelly already alluded to, already talked about, the billions of dollars for schools that went out, and there were sub-allocations based on each state, which you already went through. And then, of course, an extension of the Money Follows the Person program through November. Go to the next slide, please. So since the time that CARES Act passed on March 27th, there's been a lot of discussion about what could come next, because there's an acknowledgement there's a likely need for more relief to be provided to individuals and families, to businesses, and to the healthcare system. Those negotiations and discussions still continue up till now. I did want to mention on April 24th, this bill called the Paycheck Protection Program and Healthcare Enhancement Act passed. This was referred to as COVID 3.5. And the reason for the 0.5 is that it was very narrowly focused. The Paycheck Protection Program that was created to provide forgivable loans for small businesses ran out of money. There were $350 billion provided for small businesses to apply for, and because of the huge crisis that our country has faced, there was a large amount of demand, and so there was a need to replenish those funds. So in a very narrow sense, Congress passed a bill that addressed replenishing those funds, as well as providing for some additional funding for hospitals and testing, but with the understanding that this is probably not going to be the last action taken by Congress to address the COVID crisis. Go to the next slide, please. So throughout this crisis, and even during March, April through now, we've been trying to listen to you all, to everybody in the community, and you, and we hope that if there are additional things that come to mind that you feel need to be addressed, please contact us. We really continue to try to listen and bring those concerns directly to members of Congress and the federal agencies. So, one of the top priorities that we've been advocating on, along with many other disability rights organizations, is additional funding for home and community-based services, where we want to ensure that these are available where it's possible, to provide the personal protective equipment, PPE, to providers, to provide additional hazard pay to ensure that there's a continuity in the workforce to provide these really extraordinarily important services for our community. And so we've been advocating for that. We've been advocating for the educational needs of students with autism. This is ensuring that for whatever educational opportunities are available now, distance learning or otherwise, that to the maximum extent possible, schools are providing for students, and that the federal government is providing the resources to those schools to do that, for whether it's technology or otherwise. And while we advocate for that, we also are looking at the other side of things when students return to school, understanding that the comprehensive level of education services that students had been receiving before has not been provided right now during this crisis, in that schools are going to need to address a lot of the learning loss and regression we know has occurred during this time, and they're going to need the resources to be able to do that. And so we're fighting on that front as well. Protecting the rights of students under IDEA, the Individuals with Disabilities Education Act. There was a lot of concern that some of the core protections under IDEA might be waived during this time because of the challenges with distance learning. We, along with many others, pushed back against that notion that we felt like there are flexibilities within the law right now to be able to deal with the current situation, but that a rollback of the rights and the core protections of IDEA that have been so hard fought was not the right course and not necessary at this time. Fortunately, Congress heard that and did not provide for any waivers of the core protections of IDEA. They did require the Secretary of Education to issue a report on whether or not she thought more waivers were necessary. She issued that report, did not recommend more waivers. So we were pleased that that decision, that was the decision both by Congress and the Secretary, but we understand that there are still tremendous challenges related to meeting the educational needs of students with autism, and are going to continue to fight and stay vigilant on that front. Expanded access to telehealth services, we already touched on that earlier in the presentation, and what we're doing at the federal level is trying to push for things that have worked for individuals on the autism spectrum, with the understanding that telehealth isn't always going to be the right mechanism of accessing healthcare services. So for the things that have been working and that are working for individuals on the autism spectrum, we think that they should be able to continue throughout this COVID crisis and going forward. But recognize it's not necessarily right for everyone. Eligibility for the $500 economic impact payments for dependents over age 17. This is just a fix that we think needs to be made. In the stimulus payments, there is eligibility for individuals, for dependents under the age of 17, recognizing that this is creates a huge inequity for many families and individuals throughout our country, and particularly in the autism community. We've been fighting to reverse that and to allow for retroactive payments for dependents over the age of 17. According to caregivers of adults with disabilities, the same emergency paid sick and family medical leave policies according to caregivers of children. There's a lack of clarity around this within the law that was passed in March by Congress. We, along with others, advocated with the Department of Labor to ensure that there was parity for caregivers of adults with disabilities whose regular source of care and programming was no longer available. So fortunately, the Department of Labor agreed, and they have interpreted the law in that way. And then next, preventing discrimination and treatment decisions and care allocations based on disability. I hear Josh kind of touch on this already. One of the areas we've been looking at more recently is this issue of ensuring caregivers are allowed to be in the hospital or other healthcare settings with an individual with disabilities, and it's something we're continuing to fight for and look at both at the federal and state level. And in addition to issues like ensuring that with limited resources, that hospitals and other healthcare providers aren't making decisions about who gets care based on someone's disability. Congressman Chris Smith and Mike Doyle, along with many other members of Congress, have helped in terms of sending letters to congressional leadership advocating for many of these priorities. We've been trying to talk with them, they're the co-chairs of our Congressional Autism Caucus, regularly to communicate the concerns that we're hearing directly from the community to them so that they can help with shaping any future COVID relief package. I'm gonna, if we go on to the next one, I'm just gonna very quickly say that, and you all can see the slides, which we'll send to you afterwards, that right now we're still in a stalemate in terms of what's going to happen with any next big relief package. The House of Representatives passed a bill, the HEROES Act. It was a $3 trillion bill. It included a lot of money for state and local governments and to address a number of other priorities as well. To be honest, this is really the opening salvo in negotiations. There's the Senate Majority Leader Mitch McConnell has said that he's not taking up this bill. We pointed out in here there were a number of priorities of ours that were included in the HEROES Act that were positive steps and we hope are preserved as things move forward. But at this point, the path is somewhat unclear as to where things go. So what we can tell you is that we're going to continue to fight at the federal level for the community, for these priorities, and welcome your input as we continue to move forward. So thank you. And I don't know if we have time for questions, but happy to take any either now or offline.
Thank you, Dave. I think we could. We'll leave just a little bit of time. The very last section will be about direct support and services from Autism Speaks, but that one goes relatively quickly. So Judith, do we have any federal related questions for Dave?
I think we are all covered via the chat, so nothing right now, Dave. Thank you.
Wonderful. Thanks for doing that. We invite you to, in addition to the Colorado and Denver specific Facebook group, we invite you to engage with us so that you're always receiving updated information. We will not spam you, but we'll send when there are federal or state things that we're looking to inform our community about, and those that wish to advocate on behalf of those. You can follow us through our advocacy channels on the different social media areas, or sign up at autismspeaks.org/advocacy for our grassroots network that will result in you receiving emails of this type. So we encourage you to do that. And I will now turn it to my colleague Emily, who is a manager for our autism response team, and she will tell you a little bit about some of the services that the organization can provide to you directly, and take any questions you may have about that. So thank you, Emily.
Thanks, Kelly. So I'm Emily Mulligan. I'm the manager for our autism response team. So I'm just going to take a couple minutes, being mindful that we're almost at the end, just to discuss a few resources and the types of support we provide directly for our community, particularly during this time of so much uncertainty. So first and foremost is our autism response team. So this is a great resource for the entire community. We have associates across the country who provide support via phone, email, live chat, and social media, really just to ensure that autistic people and their families have access to whatever tools, supports, and resources they may need. And we really, our number one goal is to provide really personalized and individualized support for each person. We do respond to thousands of inquiries per month, and it's really across the spectrum, across the lifespan. And we do have a designated Spanish language line. So for families whose primary language is Spanish, we have 3 associates who are available to speak via phone or via email. So you can see these are our toll-free numbers and our email address. So we're available between 9 a.m. and 5 p.m. in all time zones. So just a few of the ways that we're directly responding. I know there's been so much uncertainty and so many new challenges for a lot of families. So we're really trying to adapt and listen to the community and see what we can do to meet people's needs during this time. So number one is just, again, through our autism response team. We've heard so many different challenges and so many different needs, and that's really helped us to kind of develop some new resources and make sure that what we have is really providing the best support that we can. We also do have a specific grant called our Autism Speaks Cares Grant, and this has been helping people with a variety of basic needs. We know that there's financial impact has been significant for a lot of families. So we do have that grant. So if you're interested or if you're in need of financial support, reach out to us directly through our autism response team. And then we do have a specific COVID-19 page on our website, and this has been updated on a weekly basis kind of since this whole thing began. We have general resources for families, for autistic adults, for healthcare providers and educators, really across a kind of a range of different topics, including, special education and those needs right now, challenging behaviors, mental health. So we really have a kind of a broad range of different tools. We also have an internal task force that is in charge of developing new resources and making sure that what we have is updated on a weekly basis. So then, other than our, our COVID specific resources, we do have a wide range of different tools for families across, a lot of different topics. So that includes, we have 48 different toolkits for children, adults, families, and healthcare professionals. This covers, early childhood, the very beginning stages before families even get the diagnosis, all the way through transition to adulthood, and then adult services topics like employment, housing. And these are all available to download for free through our website. Some additional tools that we have, one is our online resource guide. This is a great tool to use if you're looking for a provider in your community. We list, a huge range of different providers, support groups, doctors, professionals, employment providers, and you can search based on your area and based on level of need or level of support needed. We also have a community events calendar, and this has definitely been an area where we've pivoted in the last few months, because we use this to compile different activities and different sensory-friendly events that are happening. Of course, there's not much happening in person now, so we've moved towards finding a lot of virtual events and making sure that the community can find find a whole range of different events that are happening. And then just a couple other, I'll mention a couple other things. These are a few examples of some of the resources we've developed in response to the COVID crisis. We have a kind of a network of professionals and specialists. So we've put together some posts on everything from dealing with school closures and transitioning to virtual learning, how to continue clinical care. This has been a big one that I know has been touched on in this webinar. Basic tips about what people should know about COVID and how to manage that. And again, we really are trying to update these frequently on a weekly basis and making sure that they really are meeting the needs of our community. And then lastly, this is just another page that I want to highlight. Just has additional resources broken up by topic. So again, you can see it's kind of throughout the lifespan, covering a range of different topics. I know this is a lot of information. I think it can be overwhelming sometimes. So I do want to say again, if you have specific questions or you need support with a situation you're dealing with, please feel free to reach out. The Autism Response Team is always happy to help. And I know that we'll send out the contact information again when we send out these slides. So thank you.
Thank you, Emily, and all my colleagues for presenting, as well as Josh. Thank you all for joining us today. We hope it's been helpful, and feel free to contact us for any further questions you may have. Have a great rest of your day.